Hey there, my name is Sarah. I'm a naturopathic doctor practicing in Toronto, Ontario. If you're interested in becoming a naturopathic doctor, then keep on watching this video because I'm going to show you what a large part of your life is going to look like if you become AND. It's going to look like this. Pretty exciting, right? Let me tell you what all this excitement is about. It's about charting! The other day I had 8 patient visits in one day, and it's really great to have a full schedule. It feels wonderful to know that your patients, benefit from treatment, and if you see patients, you actually get paid for the time you spend in the clinic, so it's great to have a busy schedule. The only downside to having a busy schedule is the massive amount of paperwork you need to do afterwards at the end of the day, or maybe even into the next day. I define charting as the daily comeuppance all practitioners must pay in order to have the privilege to practice medicine. And I've never met a practitioner who has genuinely enjoyed the paperwork that must be done behind the scenes after a patient has left the office. And if you don't know what charting is basically writing up a report or a summary of what has happened with your patient in their appointment. For each chart, you need to write down 4 things, and you can remember these 4 things by remembering the word SOAP. S-O-A-P. S stands for subjective, and this is the part where you summarize what the patient tells you verbally in the appointment. O is objective, and that is what you, the practitioner, observes about the patient. And A is assessment. Assessment means, what's your diagnosis, or what's your working diagnosis if you aren't sure exactly if you've picked the right diagnosis or not. A is really dependent on S and O. And then P stands for plan. Plan is, basically what was your treatment plan? What did you do? Did you provide acupuncture? Did you give diet recommendations, lifestyle counseling, etc.? So you need those 4 things. And writing up these SOAP charts can take forever, especially if someone is coming in with more than one complaint. Let's say they want to fix their knee pain, they want to address their anxiety, and maybe they want to manage their diabetes a bit better. 3 things. And if there are 3 things or just more than one chief complaint of the patient, then these SOAP charts can become very long, like 5 to 6 pages long. So imagine yourself having a patient, you have to write a 5 to 6 page long report on them, and then if you have 8 patients in one day, then that's a lot of writing to do. So charting is my least favorite part of being a naturopathic doctor. It's really boring and tedious, and I just don't like recounting what's already happened in the day. I prefer to just be with patients, chat with them, do the treatments, and I don't really want to have to write up a summary of everything. It is the least favorite part of the job, but compared to a lot of other jobs out there, charting really isn't that bad, and it's really not that hard, so I shouldn't really be complaining too much. And also, even though it's time consuming and tedious, charting is extremely important and can be very helpful. For example, if you take really good, detailed, and organized charts, you'll be able to remember your patients better, especially if you don't see them for several months or maybe years. If you have good notes, then you can refer back to them and remember, oh yeah, this is what I did, this is what happened in XYZ. You can carry on with your follow-up appointments very easily with them. And this is very important for patient retention because there are a lot of patients that rant to me about their practitioners and how they stopped seeing some practitioners because they kept on forgetting the details of their life. For example, there was one patient who was prescribed a medication by her family doctor, and she had a bad reaction to that prescription. And she told her doctor, she came off of the medication. And a few months down the road, she went back to her family doctor for some other reason, and family doctor recommended the first medication that she got, the one that she had a bad reaction to. And she just reminded him, like, hey, I had a bad reaction to that and I don't want to take it. And he said, okay, yeah, sorry. But then it happened again at another follow-up appointment where she was recommended the same medications, and he, I guess, forgot about it. I don't know how, but he forgot. And another patient stopped seeing a physiotherapist because he kept asking her what she did for a living almost every single appointment. And that's gotta be annoying if you see a practitioner every single week, and every single week you have to tell them you work at like Walgreens or Walmart or something like that. It's annoying, and it makes the patient feel like they're not being heard or really cared for. So it's really important to remember, some small details and large details about your patients, and you can do that if you have really good organized detailed charts. Another important reason to keep very detailed charts is, if you want to go on a long vacation or go on maternity or paternity leave, or whenever you decide to retire, you're going to need to get another naturopathic doctor to take over the care of your patients. And you want to give that next doctor the best chance of helping out your patients, and you can do that by giving them a stack of very well organized and detailed charts on your patients. This way they'll be able to read through the charts, see what has been done and tried in the past. They can see what stuff worked and what stuff didn't work, so they can base their future treatment plan on what has been done in the past. And this will also benefit your patients too, especially if they have a really long-standing chronic disease that they've had for several years, because they've probably seen several specialists and doctors and have told their health story multiple times. And for those people, it gets really exhausting to repeat their story over and over again, especially if it's really traumatic and especially if it's really changed their life for the worse. So they don't really want to recount everything to the new doctor. So if you have really good notes that explains their whole story, that doctor won't have to poke and prod and ask about the past too much and aggravate the patient. There are a bunch of other reasons for keeping good charts. These charts are legal documents, and they can be used in court cases like motor vehicle accident cases. Also, if you work in a regulated province, your regulatory body could send someone over to check in on your clinic and make sure that you are filing charts in an organized and proper manner. So that's also very important if you want to keep your job. All right, that's enough of that. We don't want to give too much of our time to charting. Thank you so much for watching this video. If you liked it, please leave a like. And if you want to see more videos like this, hit the subscribe button for more videos like this. See you in the next video, okay? Bye-bye.